Hello, my name is Taylor Erickson, and today we will be discussing and looking into clinical trials on treatments for MS. First, what is MS? MS, or multiple sclerosis, is when the body immune system launches an inflammatory attack on the central nervous system. It has been mainly interpreted that it was T cells leading this response, but recent studies have shown that B cells could also be heavily involved. Either way, there is not a lot known about these detailed mechanisms around MS and the inflammation and damage it causes. These events, or inflammation events, can happen in episodes or relapses. The inflammation damages the myelin sheath that protects the axon of neurons. Damage to these neurons can cause the central nervous system to no longer operate as normal. One way that doctors look at damage that this immune response causes is by taking an MRI of the brain. An MRI can show the damage done to the brain. Compared to a normal brain, someone with MS has splotches, also known as lesions on their brain, where damage has occurred. There is also a fog that can make the image less clear. These are usually ways to diagnose and notice MS. The brain damage that is done cannot be reversed by mechanisms of the human body or by modern medicine at this point. There are four main types of MS. We have our first type of MS, which is known as clinically isolated syndrome, or CIS. Before one can have the damage of true MS, there must be multiple episodes or relapses of inflammation before there has been enough damage. Those with these episodes can be diagnosed with CIS. Second, we have our relapsing remitting MS, RRMS, is when you had enough episodes that the brain has damage, and these episodes will continually occur, causing damage and worsening symptoms each relapse. Most diagnoses are usually RMS, and it is the most common type of MS. Third, we've got secondary progressive MS. This is also known as SPMS. And this is when the symptoms gradually will worsen over time between the relapses. So relapses aren't the only time when there is deterioration. It usually comes from RRMS and then will change into SPMS. Then we got our primary progressive MS, PPMS. And this is when there's not really that many relapses, and it's just a constant worsening. They noticeably have less brain lesions, and it's more issues with the spinal cord and damage there than other types of MS. So current disease treatment for MS has greatly improved in the years, with many drugs being able to slow or almost stop all types of progression of MS. What is available right now are known as disease-modifying therapies, or DMTs. There are three ways that these are given. An injection that an individual will give themselves is often as every day to approximately once a week. There are also oral tablets given, and they are taken once or twice a day. These are probably the most recent. And we have infusions, which are given in the hospital as often as every 1 to 6 months. All these can work to stop relapses and the progression of MS, but they cannot reverse the damage done. And there are times where they are not being able to completely stop all progression. Currently, there are trials, though, to change this inability to reverse damage. And this is the introduction of myelin repair. So far, there has not been any success to get a way on the market to reduce any or reverse any damage done on the central nervous system. One way that many companies and researchers have been looking into to repair myelin damage is by clemastine, a chemical, and it is an active ingredient in antihistamines and is commonly found in many allergy medications. But some recent research has shown that it's promoting myelin repair in mice. This research is still extremely new as 2020 when this kind of started, but it'd be huge for those impacted by MS. The possibility of Being able to fix the damage on myelin is something that should be absolutely looked into. This would be especially important for those who have suffered with MS for a long period of time. The first medication or any treatment for MS really was introduced in 1993. So those who have had it for a long time have had a lot of damage done to their central nervous system. Also, those who had late diagnoses could go back and revise the damage done. Also, not all current medications are foolproof. And these are my sources. Thank you.